Hello, thank you for taking the time to listen to this video about my research project. So this video is for anyone who's wondered about what the experiences of families are that use medicines at home, and anyone that's ever thought that they would like to do more to help families to use their medicines correctly and to get the most benefit from them. So the background to this project is about knowing that medication errors are very prevalent and they're experienced by patients throughout our healthcare system. And families are no exception to this. And in actual fact, the studies show us that about 9 out of every 10 families will use the medicine incorrectly at one point. So we wanted to know a bit more about why this is happening, which the quantitative studies aren't able to tell us. So this was using the new approach to medicines optimization, which emphasizes about that patient experience is a key part of being able to optimize medicines. And that's also included in the NHS patient safety strategy, which places an emphasis on insight, which means to use the experience of patients to help drive improvements in healthcare in terms of patient safety. So our aim was to understand more about why families have problems with medicines at home. So the method we used was to use a focus group and to use a qualitative research methods to capture that experience and listen to families talk about their experiences of using medicines. We invited families who had been treated by the Children's Hospital and had been discharged on medicines that they needed to give their young children at home. So the results were that we had 6 families attend this focus group, and it lasted for an hour, and we had a really good discussion about their experiences. We also used post-it notes during the focus group so parents could write down their experiences too. And we also had some families submit comments on social media, so we were able to include their comments as well. And we used a qualitative descriptive method, which doesn't involve too much analysis of the data, but essentially tries to summarize the data in key themes. And we came up with 4 key themes from what the patients have told us. So I'm going to go through those now with an example for you. So the first theme was about the fact that for families, it is exhausting having a baby at home. And that's not surprising, is it really? Parents are sleep deprived, they have to care for their children 24/7, and even adding one medicine into that experience for them can be very challenging, particularly when they've got to manage other care issues for their child, or they've got other children at home as well. So exhaustion is a big problem for families. The second theme is about difficulty administering medicines. So things like giving parts of a tablet or having to crush tablets or modified formulations in one way is difficult for them. Things like using syringes to measure doses can be a challenge. And also simply just trying to give a medicine by mouth can be a problem for families as well. And so that contributes to errors happening. The next theme is about difficulty keeping records. So this is where families are describing trying to keep track of everything. So it feeds a little bit into the thing about exhaustion. So trying to work out which parent has given what medicine and when, and also if they have any contacts with the healthcare system about keeping track about what medicines their child is on, what they're being used for, things like that, who's monitoring them, who's keeping track of effectiveness. So that contributes to problems as well. And then finally is an overall lack of support for families, and this both is within family structures and also within the healthcare system as well. So typically what we hear described is the fact that one parent usually takes responsibility for medicines. As a healthcare provider, we usually train just one parent, and particularly with COVID restrictions at the moment, we're only allowed one parent in hospital, so that exacerbates that problem. And what that leads to for families is it means that they can't have other members of family administer medicines, which means that childcare arrangements can be challenging, and that it usually does rely on one parent to keep track of things, so it's not a very resilient system. So those are the 4 themes that we came up with. So in conclusion, our group showed that that the lived experience of families is consistent with quantitative data. And it also showed that a qualitative method like a focus group and using qualitative methods to analyze the data really gives us good depth in terms of the experience and what that has been. And this allows us to understand why medication errors are occurring. So this is something that we're looking to study in more going into the future, and what this will allow us to do is help to think about designing new interventions or improving our existing support for families to help them to use medicines correctly. Thank you.